Are you suffering from aches and pains and would love to get back to the life that you desire? Well, Dr. Michael J. Sardo joins me now with how he is bringing physical therapy to you so you can enjoy life again. Good morning. So happy to have you here.
Good to be here.
I love when we meet people and they say, this is my passion because I have lived this and I know the struggles and literally the pains that people go through.
Yeah.
Tell us a little bit about your background and why you wanted to kind of open up this own journey and help others.
Great. Yeah. So from a young age, I started weight training about 16 years old.
Okay.
And I fell in love with it. Started training in my basement and started seeing really good results and what it could do for me, for my body, what exercise did.
Yeah.
And as I got a little bit older, I competed in 2 natural bodybuilding contests in my 20s. And I've been involved with athletics and
I was going to say, you've done sports as well.
My whole life, yes. And I played hockey at a collegiate level as a goaltender and suffered many injuries myself and also prevented many, and figured, you know, this is what I want to do. This is what I'm most passionate about, is helping people and getting that message of exercise and fitness and wellness out there to them so they can live the best life that they know how to live.
So that's what you're doing now. Explain who your typical patient is and who you're really finding success in helping with people.
Yeah, so we cater to helping the active adult get over their aches and pains without using medication, without going to doctor's visits, because this allows them the time to get back to living the most active life they desire here in Florida. You know, everyone likes to be outside.
Yeah. So what does that mean? And what I love too is you're thinking a little outside the box, and you're able to kind of tailor programs for what they really need.
Yes, absolutely. So, you know, if we take someone who's an active grandparent who wants to be able to play with their grandkids, the active parent even, men and women who are in the know, who know that medications aren't the best route. There's a lot of controversy with that these days. So what we're doing is we're using the movement as medicine, and that's going to help these individuals stay active, and it helps keep them, you know, feeling good, looking good, and it helps them to stay out of injury. No one wants to have pain. You don't want to waste time going to the doctor's visit just to perhaps get a prescription and then go and try something else that maybe didn't work for them. So what we do is we cater that specifically to that individual.
Well, and that's what we were talking about. It's this concierge physical therapy kind of aspect of it, to where it's not necessarily guided by insurance, which I think is so oftentimes done, where this is where you really sit down with patients, from what I understand, and come up with a plan that's going to get them back to feeling good no matter.
It is. It's one of the biggest differentiating factors that we have, is that we listen.
Yeah.
Number one is we listen to all of our patients and what their story is. We listen to where their pain is, what is going on with you. We spend the time to do that with them. And this allows us to go through and create a full assessment now, where it's geared towards finding what's causing the injury. You know, if, for example, if it's the knee, right? We'll look and say, okay, yeah, we're not just gonna focus on that, but we need to take a holistic approach. It could be coming from somewhere else. So we have the time to do this now. And when we have that time, people feel more at ease. They're able to trust us.
Yeah.
Right? And this helps to build that rapport and that relationship that you don't necessarily see. We provide the results and the service that the traditional healthcare system just isn't able to really bring to you.
Yeah, we have about a minute left, and that brings us to our special offer this morning. And I know you're so eager to get the word out about this. And this is where you go back to these first 10 callers who call in, where you're actually, again, willing to kind of sit down with them, listen to them, figure out what's going on, right?
Yeah, so the first 10 callers that wanted to set up a discovery visit, it's a free movement assessment.
I love that you call it that, a discovery visit.
Yeah, we're going to discover what's going on. What's the issue here? Let's find it out, and what we can do and how we can help.
Yeah, and then there's tips, I know as well, that there's an ebook that people can find out about too.
Tips report on the website, phithaus.com.
All right, well, thank you so much for coming in today. We hope to see you again soon. And again, we'll put all that info on our website, but we appreciate you sharing your story and again, your journey to help others getting back to feeling themselves again.
My pleasure, thank you.
Right.